Call to the member for Shortland.
Thank you, Mr Deputy Speaker. And I'd like to talk today about an organisation based on the Central Coast of New South Wales that is working hard to close the gap in health outcomes for Indigenous Australians. The Yerin Eleanor Duncan Aboriginal Health Centre is an Aboriginal community-controlled health organisation that provides services to 1/3 of all Aboriginal people living on Darkinjung country, or about 4,000 people. As well as the primary care of GPs, Yerin provides home visits and support for patients in hospital, support for mental health clients during hospital treatment and after discharge in the community, support for young people in an effort to stop them entering or re-entering the child protection system and the juvenile justice system, provides support for young people living out of home care and the foster parents they live with, provides help with transport, allied health services, dental services and nursing services, childcare and support for mums and bubs, drug and alcohol support, help to access the NDIS, and help with health literacy, health promotion and help to quit smoking. As you can hear, Mr Deputy Speaker, the list is long and the work is important. And yet Yerin's funding levels have not increased in 8 years and they've outgrown their workspace. As their population grows and the demand for services grows, Yerin must be supported to continue its work. We know that appropriately resourced Aboriginal community-controlled healthcare represents evidence-based, cost-effective and efficient solutions for closing the gap in Indigenous health outcomes. When services are provided by community for community, they are most effective. Nearly 3/4 of Yerin's staff are Indigenous, and the welfare of these staff is important too. As the demand for services has grown, the safety of staff has come into focus. Unfortunately, assaults have occurred. Yerin must have a purpose-built fit-out that ensures staff and patients are safe. There are other broader challenges that Yerin Centre faces. Staff say a lack of affordable housing creates problems in the community. Counselling services and support services for the chronically ill that bulk bill are in short supply. There are challenges placing children under 16 in rehab facilities for drug and alcohol problems. Children have to travel all the way to the John Hunter Hospital or to Hornsby, and places are limited. And there is a shortage of foster carers for Aboriginal children who are disproportionately represented in out-of-home care. Mr Deputy Speaker, there are 600 Indigenous children on the Central Coast living in out-of-home care, but less than half of these, only 42%, are able to be placed in kinship care. More Aboriginal foster carers are needed and more support is needed to help Indigenous children with their families and provide those families with the support they need. We are in grave danger of creating another stolen generation unless we solve this problem. I want to thank Yerin staff for their commitment to our community. They are a bedrock of the Northern Central Coast and they do great services for that entire community.
Thank you,